Question 1. Following surgery, a client is placed on a diet as tolerated food plan. Which of the following is best for the client's first post-operative meal? C. Clear liquid. The first meal after surgery should be clear liquids, only fluids, and foods that can be seen through. It is the least likely to induce nausea and vomiting. It also provides some liquids and calories, while stimulating peristalsis. A soft diet has a soft texture that is easy to chew and digest. Foods are low fiber. A bland diet has soft foods that are not spicy, fried, or raw. A full liquid diet is made up only of fluids and foods that are normally liquid and foods that turn to liquid when they are at room temperature, like ice cream. If the client can tolerate the clear liquids, the diet can be advanced. Question 2. A client has a pressure ulcer on the sacrum. While assessing it, the nurse observes that it has partial thickness, loss of dermis, and a red-pink wound bed. Which stage will the nurse assign this pressure ulcer? D. Stage 2. Stage I pressure ulcers have intact skin with a reddened area that may be firm and painful. Stage 2 pressure ulcers are indicated by partial thickness, loss of dermis, and a red-pink wound bed. Stage 3 pressure ulcers have full thickness skin loss and may contain slough, visible subcutaneous tissue, and tunneling. Stage 4 pressure ulcers have full thickness skin loss and exposed muscle, bone, or tendons. Question 3. The purpose of a splint is to D. Immobilize and allow for tissue swelling. The primary purposes of splinting for limb fractures are to protect soft tissue from further damage, allow for tissue swelling, reduce the client's pain, reduce the possibility of a fat embolism, and minimize painful muscular spasms. A splint is easily applied and removed and involves fewer complications than a cast. A cast is indicated for total immobilization, to wrap completely around the fracture or injury, and to manage complex or unstable fractures. Question 4. After your patient dies, the patient's family gathers at the bedside and asks you to step out while their clergy performs a religious rite for the deceased. As the patient's nurse, what is your most appropriate course of action? D. Allow the ceremony and step out of the room. The nurse should honor the family's wishes and culture and leave the room. Most hospitals do not have a policy that prohibits religious rites or ceremonies at the time of death. Remaining in the room shows disrespect and lack of trust at a time of grieving. Question 5. The nurse is teaching parents to instill eye drops for their 4-month-old daughter. The parents tell the nurse that she shuts her eyes tightly to avoid the drops. Which instruction by the nurse is most appropriate? D. The parents should put the drops into the inner canthus. Infants instinctively resist anything regarding their eyes by tightly closing them. The best way to instill eye drops is to gently restrain the baby's head while the baby is in a supine position and put the drops at the inner canthus of the eyes. When the baby opens its eyes and blinks, the medication will flow into the eyes. The nurse should encourage the parents to be gentle and speak to the baby during the procedure. Question 6. A nurse working at a community health fair is administering intramuscular injections of influenza vaccine. Which injection technique will avoid leakage into subcutaneous tissue? D. Injection by the Z-track method. The Z-track injection method avoids leakage into subcutaneous tissue. Pull the client's skin downward or upward, and inject the vaccination, or medication, at a 90-degree angle before releasing the skin. Aspiration is done to assure that the injection is not going into a vein or artery. Massaging the injection site can introduce the material into subcutaneous tissue. A 45-degree angle is incorrect. Question 7. The nurse teaching a 14-year-old client about her cervicothoracolumbosacral orthosis, CTLSO, brace. Which statement by the client would indicate a lack of understanding about the brace? D. I can take it off in hot weather. The Milwaukee brace, also known as a cervicothoracolumbosacral orthosis or CTLSO, is a back brace used in the treatment of spinal curvatures such as scoliosis or kyphosis in children. It is a full torso brace that extends from the pelvis to the base of the skull. Its aim is to keep the body upright and prevent progression of the curve while the patient is growing and awaiting possible need for operative intervention. The brace must be worn long-term, during periods of growth, usually for 1 to 2 years. The client's statement about not wearing the brace in hot weather is incorrect and indicates a need for additional teaching. The other statements indicate correct understanding. Question 8. Which of the following is the proper procedure for cleaning and storing dentures as part of a client's HS oral care? D. Remove dentures, clean with cool water, place in denture cup with cool water, leave within reach at client's bedside. Proper denture care is crucial to maintaining the life of the appliance and sustaining oral health. If dentures aren't properly cared for, plaque can build up, causing additional tooth loss, bad breath, and even gum disease. Dentures are fragile and easily damaged. They are also expensive, costing several $1,000s. After removing them, the proper procedure for denture care is as follows. 1. Take the dentures to the sink, line the basin with a washcloth, and fill the basin partway with cool or tepid water, but do not place the dentures in the sink. 2. Using a toothbrush, clean the surface of the dentures as if you were brushing your own teeth. Work with one denture at a time. Using a small amount of toothpaste or denture cleaner is appropriate. Be sure to clean the areas where the denture comes in contact with the gums or roof of the mouth. 3. Rinse the denture thoroughly and place it into a clean denture cup filled with cool water. Repeat this process with the other denture. 4. Place the cup within the client's reach. 5. Assist the patient with proper oral care using sponge swabs and mouthwash. Look in the client's mouth for signs of infection such as lesions. Never store dentures in a washcloth or paper towel. They could accidentally be thrown away. Question 9. The healthcare provider, HCP, prescribed a rectal tube for a post-operative client to relieve abdominal distension due to flatus. Following insertion, the nurse notes that the client's abdomen remains distended after 30 minutes. What should the nurse do next? D. Remove the tube and reinsert it in 2 to 3 hours. The nurse should remove the tube and wait several hours to give the gas a chance to advance through the gut. The use of a rectal tube to help remove flatus from the NBSB, digestive tract and NBSB, is needed primarily in patients who have had a recent surgery on the bowel or anus, or who have another condition which causes the sphincter muscles not to work appropriately enough for gas to pass on its own. And NBSB. It helps to open the rectum and is inserted into the colon to allow gas to move downward and out of the body. All the other options are incorrect. Question 10. A nurse is caring for a client whose heel has a pressure ulcer covered with intact hard, dry, black tissue. Which is the appropriate dressing for this client? D. No dressing is necessary. Current standard of care guidelines recommend that stable, intact, dry, adherent, intact without erythema, eschar on the heels should not be removed. Eschar works as a natural barrier or biological dressing by protecting the wound bed from bacteria. Unless it is wet, draining, or loose, it should remain in place. Unless the nurse is a certified wound specialist, removal or debridement of eschar is performed by a healthcare provider, HCP. The other dressings are not indicated. Question 11. The parent of a child with a short leg fiberglass cast phones the clinic because the child complains of constant itching inside the cast. Which intervention is appropriate for the nurse to suggest? D. Tap on the cast at the itchy spot. The most common complaint about wearing a cast is the itching sensation. Clients should never use an object, pencil, ruler, chopstick, etc., to reach into the cast. This could break the skin and cause an infection. Powders and lotions are not recommended either. Appropriate interventions include locating the itch and tapping on it from outside the cast, blowing cool air from a blow dryer into the cast, and wrapping a watertight ice pack or a sealed bag of frozen vegetables on the outside of the cast to cool the itchy area. Question 12. A female patient complains of abdominal discomfort. Watery stool has been leaking from her rectum. This could be a sign of D. Fecal impaction. Fecal impaction can be serious. When constipation is not resolved, stool becomes hardened and unable to pass. Liquid stool may pass around the impaction. Patients may complain of feeling bloated, having the urge to push, nausea or vomiting, or not wanting to eat. The impaction may need to be manually removed. Patient education should include increasing liquids and fiber, as well as regular physical activity. Question 13. A father brings his 6-month-old son and 3-year-old daughter for their routine checkups. What is the nurse's best strategy? D. Let the 3-year-old play during the baby's examination. Start with the least anxious and most cooperative sibling. Allow the older sibling to play. This reduces anxiety and allows them to become familiar with the examination. Children are more comfortable and cooperative when a parent is present. Question 14. During assessment, the home health nurse learns that the client has a fecal impaction. Before proceeding to manually remove the stool, what is the nurse's priority? D. Recall that cardiac dysrhythmias are a possibility. A fecal impaction is a large lump of dry, hard stool that stays stuck in the rectum. It is most often seen in people who are constipated for a long time. Treatment of a fecal impaction includes administering an enema to soften the stool to produce a bowel movement, or manually removing the impaction. With a lubricated glove, insert the index finger into the rectum to break up the hardened stool with a circular motion. Cardiac dysrhythmias and reflex bradycardia can occur from vagal nerve stimulation. Question 15. Before administering a scheduled 300 ml enteral feeding bolus to a comatose adult client, the nurse aspirates 100 ml of gastric residual volume. Which nursing action is most appropriate? D. Administer the bolus as prescribed. Standard practice includes measuring gastric residual volume prior to administering an enteral feeding. According to current American Society for Parenteral and Enteral Nutrition, enteral feedings can be administered with a residual up to 500 ml. However, individual HCP orders should be followed. Signs of feeding intolerance include abdominal distension and/or pain, constipation, nausea, vomiting, and sense of fullness. Question 16. An adult client with a fractured right tibia is placed in a leg cast. The healthcare provider, HCP, prescribes axilla crutches for use at home. The client tells the nurse there are stairs at home and wants to learn how to go down the stairs using the crutches. When reinforcing instructions about proper technique to descend stairs, what is the client's first step? D. Place both crutches on the first step. When descending stairs with crutches, both crutches are placed on the first step. Next, place the affected lower extremity and then the unaffected lower extremity. Crutches are medical devices designed to aid in ambulation, by transferring body weight from the legs to the torso and arms. Axilla crutches are the most common type. Question 17. When cleaning the perineal area around the site of an indwelling catheter, the nurse should D. Wipe the catheter away from the urinary meatus. The catheter should be wiped away from the meatus, to decrease the risk of introducing pathogens into the urinary tract. The perineum should be washed gently with soap and water. Powder can retain moisture, leading to an infection. Question 18. A client with diabetes insipidus has urine output described as D. Move the cane at the same time as the weak side. A standard cane is generally appropriate for people with mild sensory, coordination, or balance problems. And NBSB. To safely use a cane, 1. Hold the cane on the stronger side of body, or the stronger leg. 2. Position the cane slightly to the side and a few inches forward. 3. Be sure the cane is not close to the feet to avoid tripping. 4. Move the cane forward simultaneously with the weaker side of the body or weaker leg. 5. Plant the cane firmly on the ground before stepping forward with the stronger leg. Question 19. The tool that predicts the risk of developing a hospital or facility-acquired pressure ulcer or injury is called the C. Polyuria. Polyuria is a primary symptom of diabetes insipidus, with urine output more than 3 l/day. These clients have decreased or absent vasopressin secretion, which causes water loss in the urine and increased serum sodium. Anuria is the absence of urine output. Oliguria is urine output of less than 500 milliliters per day. Dysuria is difficult or painful urination. Question 20. When applying the principles of pain assessment and management, what is the priority? C. Braden scale. The Braden scale uses a score from less than or equal to 9 to as high as 23. The lower the number, the higher the risk for developing an acquired ulcer or injury. And NBSB, the Braden scale should be used on admission, transfer, and receiving, and with any change in the client's condition. The Likert scale is used on questionnaires. The misophonia scale is used for a disorder in which certain sounds trigger emotional or physiological responses. The APGAR scale measures the health of a newborn. Question 21. The nurse is educating a client with primary adrenal insufficiency, Addison's disease, on diet and nutrition changes needed to manage the client's disease. Which statement by the client would indicate that the nurse's instructions have been effective? A. Perception of pain is subjective. Since pain is subjective, self-report is considered the gold standard and most accurate measure of pain. And NBSB. The other options are important to consider and possibly implement, but only after assessing the client's level and quality of pain. Question 22. The Post-Anesthesia Care Unit, PACU, provides a report to the pediatric nurse on a 15-month-old who has had repair of a congenital hip deformity. What type of traction does the nurse anticipate will be used for the child? C. I should increase sodium and fluids, but limit potassium. Addison's disease develops when the adrenal glands are damaged. They don't make enough of the hormones cortisol and aldosterone. Besides corticosteroid medications, dietary changes include increased sodium, decreased potassium, and adequate fluid intake. Question 23. The pediatric nurse receives a 1-year-old child with a hip speaker cast application to treat hip dysplasia. Which of the following nursing actions should be implemented for the child? C. Bryant's. Bryant's traction is used following surgery to correct a congenital hip deformity. The child's legs are wrapped with moleskin tape and adhesive elastic bandages, which are connected to the traction's ropes and weights. The tension stabilizes the end of the femur in the hip socket as the site heals. Russell's traction is used to align a fractured femur. Buck's traction is skin traction used for femoral, acetabular, and hip fractures as well as low back pain. Dunlop's traction is used on children with certain fractures of the upper arm, when the arm must be kept in a flexed position to prevent problems with the circulation and nerves around the elbow. Question 24. One of the nurse's patients has a nasogastric (NG) tube for tube feedings and medications. Which nursing action is appropriate when caring for this patient? A. Apply waterproof tape to the cast around the genital diaper area. The most important aspect of caring for the cast is to keep it clean and dry to maintain skin integrity. Shortly after the child returns from surgery, waterproof plastic tape should be applied around the genital area to prevent soiling of the cast. Use the tape to petal the edges to keep them dry and clean. To help facilitate drying, the child should be turned every 2 hours from side to side and front to back, with the head elevated at all times. If a crossbar is used to stabilize the legs, it should not be used to turn the child because it might break off. After the cast has completely dried, if it becomes damp, either expose it to air or use a hairdryer, set to cool, to help dry the cast. Question 25. During an initial client assessment, which of the following techniques will the nurse use to gather subjective data? A. Check the area where the tape is applied. QD. The nurse should change the tape at the patient's nose every day and assess the skin for breakdown. Tubing and feeding items are replaced every 24 hours. The NG tube is flushed with warm water to avoid burning the patient or causing discomfort. The bed is placed in the high Fowler's position for tube feedings. Question 26. An unconscious trauma patient is admitted to the ICU. The healthcare provider, HCP, prescribes enteral feedings via the nasogastric, NG, tube. Before the nurse administers a formula feeding, which finding by the nurse requires immediate action? B. Conduct a client interview. Information obtained from the client's perspective is subjective. Laboratory results and physical assessments are objective data. Describing the client's behavior without any interpretation or bias is also considered objective. Question 27. A client hospitalized with primary biliary cirrhosis complains of severe itching, pruritus. Which of the following nursing interventions is most helpful for the client? C. Breath sounds are decreased in the right lower lobe. A major risk associated with enteral feedings is aspiration, resulting in atelectasis and pneumonia. The right lower lobe, RLL, is the most common site. Clients should be positioned at a minimum of 30 degrees of head elevation during feedings and up to 2 hours afterward. The nurse should verify tube placement before each feeding, or every 4 to 8 hours if the client is receiving a continuous feeding. Residual volumes of up to 100 milliliters are acceptable. Urine output of less than 30 milliliters per hour should be reported to the HCP. Decreased bowel sounds should be monitored but are not an immediate concern. Question 28. When the nurse enters a patient's room to administer insulin, the patient is in an awkward position in her bed. What should the nurse do first? C. Cut the client's fingernails. Itching, pruritus, is a symptom of chronic liver disease, such as primary biliary cirrhosis, primary sclerosing cholangitis, and hepatitis B and C. Research has not determined the exact cause. Nails should be cut short. Scratching can break the skin and lead to an infection. Keeping skin covered can help resist the urge to scratch. If the client tends to scratch during sleep, they can wear gloves to bed. To prevent or ease skin irritation, the client can use warm or cool water for bathing, apply cool, moist compresses, avoid the sun and hot environments, use mild fragrance-free soaps, and wear loose-fitting clothing. Avoid drying products that contain alcohol or perfumes. Hypoallergenic bed linens or bed linens washed in special detergent may help, but they are not the best action. Prescription medications may also be useful. Question 29. A client who sustained a fractured femur in a construction accident is admitted to the orthopedic unit directly from surgery. The client is in skeletal traction. Which nursing action is the priority? C. Reposition the patient. The nurse's first task is to make the patient comfortable. Once the patient is repositioned, the nurse can proceed to check the patient's ID band and ask the patient to state her name. The nurse may then administer the insulin. Question 30. The nurse is instructing a client with a new ileostomy on when to empty their pouch. Which of the following instructions is correct? B. Perform frequent neurovascular checks. The nurse should perform neurovascular checks as ordered and as indicated. The neurovascular assessment of the extremities is performed to evaluate sensory and motor function, neuro, and peripheral circulation, vascular. The components of the neurovascular assessment include pulses, capillary refill, skin color, temperature, sensation, and motor function. Pain and edema are also assessed during this examination. The other actions are appropriate but are not the priority. Question 31. Which skincare instruction is correct for a male client receiving head and neck radiation therapy? C. Empty it when it is 1/3 to 1/2 full. The pouch should never become more than half full, 1/3 full is best. A full pouch is heavy and can loosen the seal, causing a leakage. Ileostomy output will be liquid or pasty depending on the client's diet. They will need to empty their pouch 6 to 8 times per day. Question 32. The nurse calculates the 1-minute APGAR score for a neonate with the following: 1. Respiratory effort, slow. 2. Heart rate, 120 BPM. 3. Muscle tone, some flexion of extremities. 4. Reflex irritability, vigorous. 5. Skin color, body pink, blue extremities. What score does the nurse assign? A. Braden scale. The Braden scale uses a score from less than or equal to 9 to as high as 23. The lower the number, the higher the risk for developing an acquired ulcer or injury. And NBSB. The Braden scale should be used on admission, transfer, and receiving, and with any change in the client's condition. The Likert scale is used on questionnaires. The misophonia scale is used for a disorder in which certain sounds trigger emotional or physiological responses. The APGAR scale measures the health of a newborn. Question 33. Before administering a soap suds enema, which position is appropriate for the client? B. Avoid shaving with a straight-edge razor. During radiation therapy, the client should use an electric razor to avoid irritation or cuts. Antibacterial soaps are too harsh, a mild soap should be used instead. The radiation area is left open to the air. Lotion may be used several times a day, but not 4 to 5 hours before a treatment. Lotions or creams should not be applied over the radiation marks. Question 34. A pediatric client with a diagnosis of leukemia is experiencing nausea and vomiting from chemotherapy. Which of the following food will be best in providing adequate nutrition at this time? C7. APGAR is a quick test performed on a baby at 1 and 5 minutes after birth. The 1-minute score determines how well the baby tolerated the birthing process. The 5-minute score tells the healthcare provider how well the baby is doing outside the mother's womb. Scoring is 0, 1, or 2 for each category. A perfect APGAR score is 10. Scoring categories are as follows: 1. Respiratory effort, 0 equals not breathing, 1 equals slow or irregular, 2 equals strong cry. 2. Heart rate by stethoscope, 0 equals no HR, 1 equals NDLT, 100 BPM, 2 equals GT, 100 BPM. 3. Muscle tone, 0 equals loose floppy, 1 equals some tone, 2 equals active motion. 4. Reflex irritability or grimace response, 0 equals no reaction, 1 equals grimacing, 2 equals cough, sneeze, or cry. 5. Skin color, 0 equals pale blue, 1 equals body pink, extremities blue, 2 equals entire body pink. Hence, the nurse assigns a 1-minute APGAR score of 7 to this infant. Question 35. When preparing a client for the removal of the nasogastric (NG) tube, which instruction to the client is correct? A. SIMS. To receive an enema, the client should be in the SIMS position. The client lies on their left side, with the right leg flexed forward. This position facilitates the flow of the enema solution into the rectum and colon. Supine position is lying horizontally with the face and torso facing up. Prone position is lying horizontally with the torso down and the head turned to the side. Lithotomy position is lying on the back with hips and legs flexed 90 degrees. Question 36. The nurse in the prenatal clinic is teaching a client who is a vegetarian how to avoid iron deficiency anemia during her pregnancy. Which food choice by the client indicates a need for further instruction? A. Cold foods with no smell. Nausea and vomiting are common side effects of chemotherapy cycles. The healthcare provider, HCP, will prescribe antiemetics for the child. However, the child may still feel nauseous and not feel like eating. Frequent sips of fluids and small meals can be helpful. Cold foods that don't have much smell are often tolerated the best. Examples: fruit juice, cured fruit, cold desserts. After nausea has passed, high-calorie, high-protein foods can be offered. Question 37. The nurse is providing discharge instructions to parents of a 3-year-old who was hospitalized for severe croup. In the event of a future croup attack, what non-pharmacological intervention can the parents do at home? C. Take a deep breath and hold it. Holding the breath partially occludes the airway, reducing the chance of aspiration. When the client breathes as soon as the NG tube is out, the trachea is protected from gastric contents. The nurse pulls the NG tube out steadily during the procedure. The other options are incorrect. Question 38. The nurse delivers a meal tray to a client of Orthodox Jewish faith. The tray contains a cheeseburger with lettuce and tomato, French fries, a fruit salad, and a vanilla milkshake. What is the nurse's best action? A. Scrambled eggs and wheat toast. Vegetarians, and especially vegans, must eat twice as much iron as non-vegetarians. Non-heme iron, the type of iron found in grains, lentils, vegetables, and fruits, is not as well absorbed as heme iron. Moreover, the iron stores of vegetarians are often lower than those of people who eat meat. Anemia during pregnancy can lead to premature delivery and can decrease the baby's birth weight. It can also reduce iron stores that are accumulated by the baby during gestation, putting the baby at greater risk for iron deficiency later on. It is important for pregnant vegetarians to eat plenty of iron-rich foods in combination with vitamin C-rich foods several times a day. When iron is consumed at the same time as vitamin C, its absorption rate is doubled. Question 39. A client in the emergency department is experiencing the fight-or-flight response, a sympathetic nervous system reaction. Which of the following will the nurse expect to observe? C. Take the child into a steamy bathroom. If their child develops croup at home, the parents should make steam by running a hot bath or shower in a closed bathroom. They can then take the child into the steamy room and let the child breathe the moist, humid air. This will liquefy and mobilize secretions. The parent should hold the child in an upright position and reassure the child. A dry room does not help loosen secretions. Crying can irritate and contribute to hypoxia. Question 40. The nurse is educating a client with hypovolemia related to dehydration. Which statement by the client indicates a need for further instruction? B. Remove the tray and order a new meal. The nurse should remove the tray and request a new kosher meal for this client. The food laws of Judaism are strict regarding preparation and serving. Food that is allowed is called kosher. Food that is forbidden is called treif. Orthodox Jews follow the food laws carefully, believing it demonstrates obedience and self-control. Land animals must chew cud and have split hooves. Pigs do not. Seafood must have fins and scales, so shellfish is not permitted. Meat and dairy may not be eaten at the same time, or be presented on the same plate.